Imagine feeling constantly fatigued, thirsty beyond quenching, and experiencing unexplained weight loss. These symptoms could be subtle signs of a silent but serious condition, type 1 diabetes. But how is it diagnosed? In this journey through the intricacies of diagnosis and screening for type 1 diabetes, we unveil the tests, markers, and pivotal moments that lead to identification. Join us as we explore the critical steps in catching this condition before it catches you off guard. Number 1. Symptom recognition. This is a critical aspect of diagnosing type 1 diabetes, as it helps you and healthcare professionals identify potential warning signs that may indicate the presence of the condition. One of the hallmark symptoms of diabetes is excessive thirst. This occurs because when blood sugar levels are high, the kidneys work to remove the excess glucose from the blood through urine. This process, known as osmotic diuresis, results in increased urination, leading to dehydration and triggering the sensation of thirst. High blood sugar levels cause the kidneys to work overtime to filter and absorb excess glucose. As a result, the bladder fills up more quickly, leading to frequent urination. People with diabetes may find themselves needing to urinate more frequently, even waking up multiple times during the night to use the bathroom. Despite increased appetite and food intake, people with undiagnosed or poorly managed diabetes may experience unexplained weight loss. This occurs because the body is unable to properly utilize glucose for energy due to a lack of insulin. As a result, the body begins to break down fat and muscle tissue for energy, leading to weight loss. Inadequate glucose uptake by cells, coupled with the body's inability to use glucose efficiently for energy production, can lead to feelings of fatigue and weakness. Without enough glucose to fuel cells, people with diabetes may experience decreased energy levels and overall feelings of lethargy. Additional symptoms of diabetes may include blurred vision, slow wound healing, frequent infections, such as yeast infections or urinary tract infections, and tingling or numbness in the hands or feet. It's important to note that while these symptoms are commonly associated with diabetes, they can also be indicative of other medical conditions. Therefore, it's crucial for people experiencing these symptoms to seek medical evaluation and testing for proper diagnosis and treatment. Number 2. Blood glucose testing. In the aspect of managing diabetes, blood glucose testing is fundamental. It involves measuring the concentration of glucose present in the blood. This testing is crucial because it helps people with diabetes and their healthcare providers monitor blood sugar levels to assess the effectiveness of treatment, make necessary adjustments to medication or lifestyle, and prevent complications associated with high or low blood sugar levels. For routine monitoring of blood sugar levels at home, people with diabetes often use blood glucose meters. These portable devices require a small drop of blood, usually obtained by pricking the fingertip with a lancet, which is then placed on a test strip inserted into the meter. The meter then provides a reading of the blood glucose level within seconds. Continuous glucose monitoring systems consist of a sensor placed under the skin to continuously measure glucose levels in the interstitial fluid. These sensors transmit data wirelessly to a receiver or smartphone, providing real-time glucose readings and trends over time. Regular blood glucose testing enables people with diabetes and their healthcare providers to adjust medication dosages, meal plans, and physical activity levels to achieve target blood sugar goals. By maintaining blood sugar levels within target ranges, it can reduce the risk of complications such as cardiovascular disease, kidney disease, neuropathy, and retinopathy. Blood glucose testing helps identify episodes of low blood sugar and high blood sugar, allowing for prompt treatment to prevent adverse effects such as loss of consciousness or diabetic ketoacidosis. In summary, blood glucose testing plays a central role in diabetes management by providing valuable information about blood sugar levels, guiding treatment decisions, and promoting overall health and well-being. Number 3. A1C test. The A1C test, also known as the hemoglobin A1C test or glycated hemoglobin test, is a blood test that provides valuable information about a person's average blood sugar levels over the past 2 to 3 months. It measures the percentage of hemoglobin that is coated with sugar in the bloodstream. When glucose enters the bloodstream, it binds to hemoglobin, the protein in red blood cells that carries oxygen throughout the body. This process is called glycation. As red blood cells circulate in the body for about 2 to 3 months, the amount of glycated hemoglobin increases proportionally to the average blood sugar levels during that time. It measures the percentage of hemoglobin that is glycated. It reflects the average blood glucose concentration over the lifespan of red blood cells, providing an indication of overall blood sugar control. Regular A1C testing is essential for monitoring long-term blood sugar control. It helps healthcare providers and patients understand how well diabetes management strategies, such as medication, diet, and exercise, are working over time. Healthcare providers often set target A1C levels for people with diabetes based on factors such as age, overall health, and the